Hello. Oh. Hello and welcome parents and community members. It is 5 o'clock. Thank you for taking time out of your busy evening to join us and receive what we have to give. Let's wait one more minute to make sure that everybody who wants to join has joined in. Give us 1 minute. Thank you. Okay. Well, thank you for waiting a few moments to let other people join in. We will be recording for the duration of the meeting and the workshop. Thank you so much for joining us today, parents and community members. Welcome to the COVID vaccine is here. What's next? My name is Nashay Brown, and I am a community health and education worker with the Loma Linda ICP, which is the Institute for Community Partnership, and El Sol, located in San Bernardino, California. Today's workshop was created to provide accurate information about the vaccine currently being distributed throughout the county of San Bernardino. Here are a few house rules. It will be great to have a pen and paper ready to take notes throughout the session. Please raise your Zoom icon hand during Q&A so that we can recognize you for questions and answers. Also, it will be best to utilize the chat box so that we can also see your answers as well. If we do not get to all of your questions today, we will wrap around and correspond with you later on to give you those questions and a full printout of the answers. At the end of the workshop, there will be an incentive opportunity drawing to win a gift card, a swag bag for all of you that complete the survey. Okay, you will have 24 hours to complete that survey, and then we will call you and let you know that you've won. Allow me to introduce who will be speaking today. We have Dr. Jacinda Abdul Matukabir, who is currently an assistant professor at LLU School of Pharmacy in Loma Linda. Whoop, whoop. She is focusing on multi-drug resistant bacteria to improve patient treatment strategies. She is an active member of the Infectious Disease Society of America. We also will hear from a very prominent and well-known leader, Pastor Samuel Casey, of whom I had the pleasure of organizing with for the past 6 years. He is the founder of New Life Christian Church in Fontana, and he also serves as executive director of what we like to call COPE. COPE is the acronym for Congregations Organized for Prophetic Engagement. He has received numerous of awards for his social justice and prophetic work here in the community of San Bernardino in the Inland Empire as well. We will hear from Dr. Michael Segura, who graduated top 10 of his class. Wow. And currently serves as National Risk Director for Vituity Healthcare. We will also hear from Dr. Javier Sanchez, who is the Vice President of San Bernardino County Medical Society and is a valued family practitioner at Kaiser Hospital. We will also hear from Mr. Javier Sanchez, who is the Vice President of the San Bernardino County Medical Society. Dr. Abdul will be giving a presentation on what the new COVID-19 vaccines are. Pastor Casey will provide his support for the COVID-19 vaccine as a community leader. And Dr. Secura and Dr. Sanchez will work together as county representatives, and they will provide information on the vaccine distribution. After we hear from them, we will open the floor for Q&A. And let's hear from Dr. Abdul at this moment. And she likes to be called Dr. Jam, is that right?
That is right. I figure it's easier for everyone to say.
Welcome.
Thank you. All right, I'm going to share my screen. Okay, it is my hope that everybody's looking at the screen right now. Okay, so once again, thank you all for having me. I'm really excited to be here speaking with you all. My name is Dr. Jacinda Abdul Mutakabir, but I go by Dr. Jam. So I want to make sure that this presentation remains conversational and really allows for you all to grasp information and kind of conjure up questions as we move along. But I do want to provide an overview of what it is that we'll talk about. So we'll just briefly talk about types of vaccines. I think it's important that we get some background information. We'll talk about the coronavirus spike protein mutations. We'll talk about the specific Pfizer vaccine clinical study. We'll talk about the Moderna vaccine clinical study. We'll talk about COVID-19 and pregnancy, and then those women that may want to get pregnant. And then we'll just summarize the current vaccine recommendations. So when thinking about vaccines, we want to start with live vaccines. So what are live vaccines? Live vaccines are a weakened part of a virus or bacteria that's injected into you, and then your body mounts a protective response or starts to build what we know as antibodies. So an example of this would be the measles, mumps, and rubella vaccine. And then we have inactivated vaccines. So inactivated vaccines are exactly as they sound. They're dead or killed vaccines. They're injected into you. However, despite the fact that they are dead or killed, they still maintain a bit of integrity so that when they are injected into you, your body's able to still mount a protective response. So should you see whatever it is that you've been vaccinated with, in this instance, let's say Tdap or the tetanus, diphtheria, or pertussis vaccine, when you are injected with that, your body will mount a protective response. So should you ever see any of these viruses or bacteria, you would be protected against them. The protection, however, is not as though it would be should you receive a live vaccine, because these are inactivated. So they require what we know as a booster shot, or you have to get the vaccine again. So with the Tdap vaccine, we know that you get it once and then you get it every 10 years. So I want us to talk about the vaccines that we're currently seeing with COVID-19. I want us to give us a bit of background. So if I kind of go back and talk about live and inactivated vaccines, we have some context. So we have mRNA vaccines. So mRNA is used in our bodies normally. Everyone has it. And what mRNA does is it sends messages to your cells to make specific proteins for your body to use for its normal everyday functions. So in the case of COVID-19, your body creates mRNA, or mRNA is injected to you from the vaccine for your body to create the spike protein. So that's the specific protein that it carries the message for. So once your body creates this spike protein, you then mount an immune response against it. So that's the idea behind the Pfizer and the Moderna vaccine. And then we have the adenovirus vector vaccines, which is what we've been hearing in the news when we hear about the Janssen vaccine, or Johnson & Johnson, or the AstraZeneca vaccine, correct? So with this vaccine, it uses what we know as an adenovirus vector, or adenoviruses. So adenoviruses are unable to cause true infection in humans, but they use what we know as a Trojan horse. And that Trojan horse being, I don't know if anyone's seen Troy, the movie Troy, but that's kind of what they use. So it looks as though your body is actually trying to mount an immune response against that adenovirus. But what that adenovirus vaccine is carrying is that specific genetic information to actually code for that spike protein that we talked about in the mRNA vaccines. So once your body is able to make that spike protein, your body sees it, and then it mounts protection or antibodies against that specific spike protein. So I do want to talk about the coronavirus spike protein mutations. I know this is something that frequents the news, and I know it's a question of should I even get the vaccine if these mutations are happening. So I'm going to get ahead of the curve here. So we have a spike protein. I think this figure is amazing, and what it really does to just show us what these spike proteins are. So we have this spike protein, and we see this here, and we see T cells, and then we see antibodies. So the T cells and the antibodies are just our different tiers of protection that we have against this spike protein. So our T cells are like that immediate tier of protection that we receive. And then our antibodies or our B cells or our memory cells are what our body is supposed to remember having been exposed to this coronavirus vaccine. So once it sees this spike protein, your body will make T cells. And then over time, it'll say, hey, should we see this again, we need to make these antibodies so that we can remember that we've seen this coronavirus spike protein. So if we see it in real life, we'll be protected against it. So I think it's important that we see these different color antibodies, right? We see blue, we see yellow, we see purple. I think this is just representative of just the different types of antibodies that our body makes to this spike protein. We don't just make one specific antibody. So we don't just make the blue antibody. We don't just make the green antibody. We make a myriad, of antibodies. Excuse my inability to use technology. So then when we see here that mutation, we see that mutation has occurred right here, and we see an X over this blue antibody. So what that means is that viruses are smart. These viruses are able to kind of change the way that they work in different areas. So with them changing the way that they work in different areas, we can see that that one antibody doesn't bind in that one particular position. However, these other antibodies do still bind in those other particular positions. So that means that our bodies are capable of forming different types of antibodies and different types of protection. So one mutation won't necessarily make that vaccine something that we were unable to achieve immunity with. So I want to make sure that that's clear, and then we can get into specifics when we have questions later on. So I want to talk a little bit and just highlight the Pfizer study and kind of make sense of these numbers that we hear. So with the number of participants, we had about 40,000 participants, and I just want to give that blanket statement of this is pretty much one of the most robust studies that we've ever had for vaccines, especially in terms of participant enrollment. So these vaccines are what we like to call randomized controlled clinical trials, and they are blinded. So that means that individuals receive they're either allocated to receive the vaccine or to not receive the vaccine, and this is done at random, and is not done at the discretion of the people that are conducting the study. So they try to make sure that it's as fair as possible. So it's about an even split between those individuals that receive the vaccine and those individuals that don't receive the vaccine. And why do we want this? Because we want to know, does this vaccine actually work, against this virus? So if individuals were to receive nothing, would it actually work should they receive the vaccine? So I think it's important that we look at the individuals that were included in the study, because we want to know, were there underrepresented minorities included in this group? Will the vaccine work in these specific groups? That's important, right? So I like to really break down the statistics and the inclusion criteria. So there were a bit over 3,000 individuals included total, in that study. So about 9.3% that were Black, and that being about 1,500 or a bit underneath, a bit over 1,500 that received the vaccine, and then 1,500 or a bit over that did not receive that vaccine. And although that 9.3% may seem small, it's actually representative of the amount of Black people that actually inhabit the United States. So Black people represent about 12.5% of the entire United States population. So that small number is actually just quite representative of what we actually make up. And then the same for Hispanic and Native American. There were about 10,053 participants that were Hispanic, evenly split amongst the individuals that received the vaccine and those individuals that did not. The same with those individuals that were Native American. And once again, although these percentages may seem small in the grand spectrum, they're quite representative of what these groups represent in the United States, which is what we want to see. And then 42.2%, or about 16,000 of those individuals were, I don't like to say elderly, I like to say are seasoned individuals. So they were greater or equal to 55 years old. So we want to make sure that those individuals that are in those older age range are also represented, right? Because we know that the virus disproportionately or affects those groups more than others. We know that from the news and the media. So I want to focus on the number of COVID-19 cases. So there were 39 cases after that first dose in the groups that received the vaccine, and there were 82 cases after that first dose in the groups that did not receive the vaccine. So we can see that those individuals that actually received that vaccine, it was less amount of cases after that first dose, but it's still only about 52% protection, so not great. But then as we move into after that second dose, where we hear that 95% efficacy a lot in the news. I know Dr. Fauci, he uses that number a lot. So we get that 8 versus 162. So there were 8 individuals that were actually diagnosed with COVID-19 after they received that vaccine, and then 162 that did not receive the vaccine that were diagnosed with COVID-19. Wow. We see just a humongous difference, right? In those individuals that were diagnosed with cases in those two groups. So 95% efficacy, which comes in second to the MMR vaccine, which we've had for decades. So that's amazing that we see that efficacy there. But I think it's also important that we talk about the fact that you can still, in fact, get COVID-19 after you are vaccinated. This isn't 100% efficacy. So it's important that we look at the severe cases. So how many people actually had to go to the hospital for severe COVID after they received this vaccine? So there were 10 cases total in the Pfizer study, and only one of them was in the group of those individuals that received the vaccine. How amazing is that? We see only one in that vaccination group. So of course, we have to talk about those most recently reported adverse effects, and it was headache, injection site tenderness, low-grade fever, all of which can be remedied with ibuprofen or Tylenol. And then I'll go through the Moderna study just a bit. It's very similar to the Pfizer study. So if we were able to digest the Pfizer information, we can do just the same with Moderna. So there were about 30,000 participants here, so not too much less than the Pfizer study. Once again, evenly split between those individuals that received the vaccine and then those that did not. There were about 3,000 individuals that were Black, 10.2%. But once again, as I told you all with those numbers previously, pretty representative, right, to the actual United States population. So let's focus on that number of COVID-19 cases. So there were 9 in that vaccination group versus 67 in that group that did not receive that vaccine. So we see some efficacy here. But that first dose here can kind of be misleading, because you can think that, oh, there's not that many cases. However, we don't know specifically when these people had their tests taken, and it's a lot of uncertainties after that first dose, because the study was designed to actually look at the efficacy or how well the vaccine worked after that second dose. So let's really hone in on that number for this study. And we see that there were 11 versus 185. So 11 cases in that vaccine group versus 185 in that group that did not receive the vaccine. So once again, how amazing is that? We see that reduction, and we see a decrease or a lower number of cases in those individuals that received the vaccine when compared to those that did not. And then once again, looking at that severe COVID-19 case, there were 30 cases total of individuals that had severe COVID-19. There were zero, absolutely none in that group that received the vaccine. So I think it's important that we focus in on that positive fact. And then, of course, most frequently reported adverse events are headache, injection site tenderness, low-grade fever. So let's take a real look at this vaccine. Let's look at what does all that mean that I talked about with those studies. So we see in that group that did not receive the vaccine at all, we see an increase in cases, right? We see the COVID cases are through the roof. Look at the group that received the vaccine. It's like 0 cases, right? That's the protection that you want when you get a vaccine. That's the protection that we have available to us with these vaccines.
Thank you. Thank you so much, Dr. Thank you so much. We really do appreciate that baseline of information. We will thank you so much, and we'll want to have you back again for the next workshop that we have. For the sake of time, let us go ahead and move on. And now we will hear from our very own Pastor Sam Casey.
Hey, Nashay Brown and community, and to each and every
Hi.
one of you, grace and peace be multiplied to each and every one of you and your families. This is certainly a difficult time, but yet we're hopeful now with the science and the faith that we have. Thanks to Dr. Jam, who did a marvelous job in taking me back to my biology class. Thank you for the refresher course and really understanding this virus. Look, my assignment really is just to speak with affinity to this vaccine as an individual of faith and as a leader in this community who understands the importance of lifting our voice at times like these. I'm most hopeful for this vaccine for one reason, is because I can mix my faith with science and speak with great confidence in this vaccine. Moving away from the conspiracy theories and all of the things that we can't come up with. What I find interesting is that even with all of the science that we have at this time, we still will question. But here's what I won't question as it relates to the vaccine, and that is my faith, not in the vaccine, but my faith in a brighter day and a brighter reality for us getting back to whatever our next normal is. And I'll close by saying this. Hebrews chapter 11, verse 1, and one translation, the New Living Translation, says that faith shows the reality of what we hope for. It is the evidence of things we cannot see. While we may not be able to see the coronavirus and or even the hope that we have for the vaccine, here's what I'm putting my faith in, and that is my faith in God and my faith in a reality and hope that the vaccine is going to allow us to get back to some semblance of not normality, but a new normal where things are better for us, where a brighter community, where we're all working together collectively, synergistically and interdependently for a brighter day within our communities, to see our children get back to greater learning opportunities, to see our families get back to going out, hanging out at the beach and eating at restaurants again. But more importantly, that we're all doing it in a safe manner, in a way that allows us the best opportunity to achieve equity and health and a brighter day. So listen, be encouraged, be strengthened. I know this has been a difficult time for each and every one of our families in education, in work. But here it is. I have hope and faith in a brighter reality and a brighter day, even though I can't see it now. Be encouraged, be strengthened, and let's work collectively together for our communities. Be blessed.
Thank you so much. He said, let's work together. We can all be part of a solution moving forward. Thank you so much, Pastor Samuel Casey. And next, we will hear from our county representatives who will provide us with information in regards to the vaccine distribution, in which we all want to know. It is very important to know that you meeting us here today, we cannot set you up for an appointment to get the vaccine. This forum is just specifically to provide accurate information in regards to the vaccine. And now we will hear from Dr. Secura.
Great. I'd like to actually have us hear from Dr. Sanchez first, and then I'll be glad to then give some specifics about the county vaccination process.
Okay, wonderful. Okay, thank you. Dr. Sanchez, it's been passed to you, sir.
Well, thank you. Thank you so much for inviting me, and thank you so much for doing this. This is very important for the community so they can get a sense of what the vaccine is about. So as representative from the county, for the county of San Bernardino, Medical Society, one of the things that I like to do more than anything else is really try to answer some questions about the vaccine and why is it important to get it. So some of the questions that was given to us in advance was some of the side effects that you can get from the vaccine. And I think Dr. Jacinda did a really good job with her presentation, telling you about what the study shows and what those side effects are going to be. And I can tell you, having had COVID at the beginning of this, of the COVID season back in late March, I got really sick, and I really made it a point to make sure I was first in line to get the vaccine. So first and foremost, we want everyone to get the vaccine, whether or not you have had COVID in the past. And number two is the side effects are pretty familiar. The headache, the body aches, the chills. Some of us can develop the side effects that are pretty severe. Some of us have very mild side effects. I know I had significant side effects. My wife, who also had COVID, had very mild side effects. So I think we need to be upfront with everyone that they may develop some side effects. So you got to be ready for that. So that way you don't back away saying, no, I don't want to get the vaccine. Number two is if do you need to wear a mask after you get the vaccine? And as Dr. Jacinda pointed out, even though these two vaccines are tremendous protection, 94, 95% efficacy, there's still a chance you can get sick. And there's still a chance not only that you can get the virus, but you can pass it on to other folks as well. So we are recommending that you continue to use the mask, practice physical distance, and keep washing your hands as before. So those are just some of the questions that have been put forth, and I wanted to share with everyone. Well, feel free to ask any other questions you may have about the vaccine, about how the rollout is going. I think Dr. Sequeira is going to talk more about the rollout that the actual county is doing to try to get everybody vaccinated. Thank you so much.
Thank you, Dr. Sanchez. So far, as of today, the United States has vaccinated about 27 million people. Dr. Jam had mentioned in the studies there were approximately 40,000 in each for the Pfizer and Moderna. Think about our experience now with the current vaccines, both of them, 27 million. And the proportion is approximately 8% African American. So that is about 1.6 million African Americans, and another 40% Latino. So that 40% of the 27 million is approximately 9 million. The safety of this is starkingly, it is amazing how safe this vaccine is. We have some allergic reactions. The allergic reactions, we have had 11 for the Pfizer, 11 per 1 million vaccines given. We have a lot of experience with this. With the Moderna, we have 6 per million. If you look at and this is for anaphylaxis, if you look at the rate of anaphylaxis in our population, it's 0.04%. So if you look, and if you convert that to per million, you actually would have 40,000 anaphylaxis reactions to penicillin in per million, compared to 11 for Moderna and 8 for the Pfizer. So, we've heard about the allergies or anaphylaxis. Just to show you and be be a great example of how safe this vaccine is. So we are now way past the study phase for these vaccines, and we have rolled them out. And what I wanted to do today, as your health officer, is walk you through a little bit of what we had. And to do that, I want to take you directly to our website. So I'm going to share my screen now. I hope I can do this. If you, can you all see this? Yes?
Yeah.
Okay. Okay, great. If you look at the top, sbcovid19.com, anyone on the web, this is an open website. This will give you and bring you to our county's vaccination webpage. If you, this looks at our current county risk levels. We're still widespread purple tier. If you go to this section right here, it says COVID-19 vaccines, and just click on, I'm clicking on it now. It will, it tells you appointments are in high demand and they're limited and based on availability of doses, which is true. We're really short on vaccines right now. Let me try and get rid of that there. And you have to understand. So this brings you to our COVID vaccine website. And this is for the entire county of San Bernardino. So this shows you that we've sent off 107,000 first doses and 67,000 second doses. This also will show you the phases. When we received the vaccine, they only had so much, and it was not very much at all. So we had to actually create phases progressively so that we would vaccinate the highest risk people first. So we started, if you click on these phases, you can see the details. We started with tier 1, where we took all of our healthcare providers, the people that were on the front lines, our doctors, our nurses, our x-ray techs, our mental health providers, our dialysis centers, our paramedics, because we only had so much. So we had to go with the tier 1, this tier 1. Tier 2 were more healthcare providers. These were our intermediate care providers. These were our community health workers, including our promotoras. So mental health, public health, field staff, etc. And we opened, you all remember, we've gone through this tier 1 and tier 2. And tier 3 is, as we get more vaccine in, we're able to expand it into the healthcare providers that are not at as great a risk as the people in the emergency departments, for instance, or the paramedics or the firemen. Tier 3 are the specialty clinics that, like your eye doctor or your ear, nose, and throat doctor or your bone doctors. And then the laboratory workers, the dentists, and the pharmacists. Okay, so we actually had enough for these vaccines. The next phase, and the government has actually changed, because the next phase was just 1B. It was the frontline essential workers. Okay, and it was and we're currently into the phase, just beginning phase 1B. Right as we were starting phase 1B, the government says we want, it was originally people over 75 and people and the essential workers like tier 1, the emergency workers like the firemen and policemen. So this was the phase 1B, but a week and a half ago, the government said, we want to open this up and we want to vaccinate anyone who's over 65 now. So on the day it was announced, our call centers basically had over 5,000 calls for people over 65 within our county. And we had very limited vaccine still. And so you can see where we're at. So this is what we're trying to work through right now. We're bringing more and more vaccines in. We've actually lined up over 200 different sites or people who, like clinics, pharmacies, all the Rite Aid pharmacies, who can actually give the vaccine. So one thing I want to emphasize, Dr. Jam mentioned these mutations. The mutations actually arise from the situation when the virus is actually growing and duplicating or replicating fast or quickly. You can imagine if you're trying to make a cake and you have only one cake and you have all day to make it, you can make the perfect cake. But if you have to make 10 cakes in 1 hour, I don't think you're going to make those cakes are going to be as perfect as the one cake that you have to make in the whole day. If the virus is growing, the faster it grows, the more mistakes it makes. These mistakes are the mutants, and so we actually can produce those antibodies with the vaccines against these spike proteins. But as the virus is growing faster and faster and faster, it's making mistakes, and some of those mistakes die right away, and some mistakes actually do well because they're more resistant, or because in the case of these mutations, they actually cause a much more transmissible. They spread much more quickly. We do know that the vaccines still work decently, at least adequately, against the current mutations. But the danger is that we're going to have more and more mutations. That the British or United Kingdom mutation is thought to be the one that's going to lead the next surge with the South African mutation. And so the key is we have to vaccinate people and slow down the disease. We have to continue to use masks. We have to show a lot of patience and with God's mercy, with our own mercy, overcome the frustration of staying at home and not being able to eat in restaurants and not be able to do all those things that we want to do with our families. Because the more we do this, the more it spreads, the faster it grows, the more mutations. And if we have the bad mutations starting to grow before we can vaccinate everyone, it's going to produce another surge of resistant bacteria. So,
Okay, well, thank you. Thank you so much, Dr. Secura. That was a lot of information, very valuable information. We really do appreciate you. We will take this moment to readjust. Before I open the floor for the platform for questions and answers, I'd like to be straightforward and remind us all that this is a forum for questions, not opinions. We definitely want to keep it centered towards questions in regards to the COVID vaccine, but not to share your opinions at this time. And now we get to, I want to invite you to stand up, wiggle, and shake it off and take a deep breath. We will have a short commercial just now.
El Sol Neighborhood Educational Center and the Health for All program are helping you enroll in healthcare programs today. Medi-Cal is a no-cost or low-cost healthcare program. It provides medical, dental, and vision services to qualified low-income San Bernardino County residents. Medi-Cal is available for individuals and families, children, and pregnant individuals with limited income. San Bernardino County residents can sign up for Medi-Cal over the phone. You can call a certified enroller to apply for Medi-Cal at 909-257-0328, or online, you can apply at www.see4yourself.com. You may be asked the following details about each person in your household: age, employment, marital status, income, identification, citizenship. The information required for each family member depends on their age, disability status, and other factors. If you would like more information, you can contact us at 909-884-3735 or follow us on our social media at El Sol Net. Thank you.
Okay, well, thank you for coming back. Once again, I just want to thank you, parents and community members, for taking your time out of your evening to spend time to learn something today. I hope that you have your questions ready, please start entering them into the chat room, as I will turn it over to Christy and Isaac to begin the questions and answers.
Okay. Well, the first question I'm seeing here is from Marcy, and it's asking, will students be mandated to receive vaccines in order to return to school?
Well, currently
Doctor?
there's no mandate for any of the vaccines. So no one is mandated by the government or by any other person or any other entity for the most part to get the vaccine. We are highly, highly recommending that if you do want to get back to normal or whatever normal it is, this is our opportunity to get back to normal. So the more people we get vaccinated, the easier we're going to get back to normal, the faster we're going to get back to normal. We need at least 70% of the population to get vaccinated, if not more. We're hoping that by the end of the year, we can get up to 80% of the population to get vaccinated. So that way we can get back to some normalcy at that time.
Thank you, Dr. Sanchez. Our next question is, if I've recently had COVID, do you recommend taking the vaccine anytime soon?
So if you've recently had COVID, you want to wait the 10-day quarantine period before you go ahead and you get vaccinated. Previously, because we didn't know how many vaccines that we would have, and if those individuals that needed would be able to get the vaccine, we said about 90 days. And that was because it was assumed that you would have about 90 days worth of protection should you be infected with COVID-19. But it's important that you remember you still should get vaccinated, irrespective of whether you've had COVID-19 or not. And that's just because we don't know the amount of antibodies that you develop or the amount of protection that you have after you've been infected with the virus firsthand. But we do know the amount of protection that you have when you get vaccinated. So you want to wait about that 10-day quarantine period.
Yeah, I also will add that there's a lot of information right now out there. So I've seen information from waiting 90 days, like Dr. Cinda said earlier, to 30 days. Right now, what we want to do is vaccinate as many people. So if you get an appointment and you've had at least 10 days after you've recovered from COVID and you want to get the vaccine, go ahead and get it.
Okay, thank you. The next question I have here is from Manuel. It says, if you usually get sick from vaccines, should you take more precaution when getting the vaccine?
I think I'll take that one. I think it depends on how sick you get, the type of sickness. If it's just a matter of a flu-like illness, then to me and to the most professionals, that means that the vaccine is working for you. That it's not really a sickness. You're not really catching COVID. You're not really catching the flu from the influenza vaccine. It's actually your body's immune system, your antibodies, your white blood cells, actually starting to produce antibodies and reacting to kill the virus. So that fever, the low-grade fever, the achiness, that's all the inflammation that occurs when your immune system is kicking up and ready to help fight infection.
Our next question is from Sonia. She wants to know if nursing moms can get the vaccine without harming the child.
Well, that's a fantastic question. And even though in the studies there was no women that were pregnant during the study and got the vaccine, I think now we have a lot more information with about 26 or 23, 24 million people getting vaccinated. We've had a number of women pregnant women get the vaccine already, and we've seen no reaction. Just recently, I read a paper saying that, especially with these two vaccines, the Pfizer and the Moderna, and the way they are made, that the particles that may create some issues actually dissolve within about 3 to 4 days after you get the vaccine. Therefore, they're not available to either cross the placenta into the baby, so there's no issue there. And the immunity that the woman gets from the vaccine, that immunity can actually, she can pass it on to the baby, so therefore it's protecting the baby. So I think as more evidence is coming out, it's becoming clearer and clearer that the vaccine is very safe for pregnant women, and it's going to be safe for women that are breastfeeding as well.
Yeah, just to add to what Dr. Sanchez said, we don't know for sure, but the American College of OBGYN, ACOG we call it, and as well as the American Pediatric Association, acknowledging that the studies aren't there yet completely, they still advocate that a mother's breastfeeding, if they choose to receive the vaccine. And remember, the babies when they're up to 2 months old, they don't make their own antibodies to fight infection. That's why if a baby less than 2 months old comes into our emergency rooms, we were very concerned if they have a high fever, because the mother's breast milk actually has what we call colostrum, or it has antibodies in it, and that's what protects your baby. So it's a good reason to do it.
Right, thank you. Our next question is from Jackson. He asks, how safe is the vaccine for children with severe asthma and other health issues such as immune problems?
So I guess I can take this one. So in the Pfizer study, at this point, the vaccine is not recommended in children. Children are vulnerable populations. So it's hard to, ethically, we can't go ahead and conduct studies in children. They do have studies, or you have a lot more stops in terms of whether these studies can be conducted. So they do have studies underway, both Pfizer and Moderna, with their vaccines in the child population. However, Pfizer is approved for ages 16 and older. But I think that we can kind of extrapolate or kind of derive that ideas from the adults that were included in these studies. And the adults that were included in these studies did have they were immunosuppressed, meaning that their immune systems did not function as properly or as well as other people that have competent immune systems. And then there were individuals that had autoimmune illnesses. It was about 2% in each study that had HIV. In the Moderna study, the Pfizer study, and then in this Janssen study that had HIV. And of these individuals, they did not see any severe, and also individuals that had asthma, they did not see any type of severe adverse events or anything of that sort. What you can do though is right after we give individuals a vaccine, we have them wait 15 to 30 minutes to ensure that nothing out of the norm happens. And typically, and praise God for this, when I've been a part of the COVID clinics, patients have been fine after receiving the vaccine, and we've had those that want to stay and wait because they are fearful of something happening. They've stayed and wait and they've been fine. So those people with those illnesses have been accounted for in the studies, and they performed well.
Yeah, I like to actually think about, it's kind of like real life examples. Our babies, remember we start the measles, mumps, rubella, and with the OPV, and when they're 2 months old, we're giving them 4 to 6 vaccines, and at 4 months and at 6 months. Think about those, and the safety profile of these COVID vaccines is much safer than the other vaccines. So we just don't have the data, to study. To say we had 40,000 children, we just don't have it yet. So because they're still on what's called EUA, or emergency use authorization, because they're still kind of on that EUA, we can't completely say they're safe. That's all. But if it were my kid, I would say yes, I would vaccinate them. But we have to wait until the study show the safety. That's
Next question is from Tracy, and she's asking, is the vaccine expected to have the same efficacy against the new strains that are now in our region?
So I can take this question just because I've been researching a lot I've dedicated my life to resistance. They've actually began testing, and this is one thing that I really love about Moderna and Pfizer. I feel like they're very comprehensive, and they're really trying to make sure that they get new research out for the resistant strains. So they've tested their vaccine against these strains, and they did see that there was a decrease in the amount of antibodies that were created when the vaccine was tested against these strains. That's the bad news. But the good news is you still produce enough antibodies to where you should be protected should you see these new strains. That means that you may initially you were producing this amount of antibodies. With the new strains, you're producing this amount of antibodies. But this is still over what you need to be protected against COVID-19. And the great thing about these COVID-19 vaccines is that you can be protected, is that they are easily modified. These mRNA vaccines are easily modified. So then in the event that they had to manufacture a vaccine and get it out there, you know, as these new strains continue to circulate, they could do that to include vaccinations for that resistant, for those resistant strains. However, that is not the case right now. At this point, you are protected.
All right, thank you. Nishay, do we still have time for another question?
We have one more minute.
Okay,
Let's get on
perfect.
that one more
Then
minute.
here we go. This is from Dina, and she asks, "What other problems are there with the vaccine, and how should I be ready to get vaccines if I've had a reaction to the flu shot before?"
Dr. Sanchez, you want to take that one?
Yeah, there, let's see. In terms of the reactions have been very consistent for what we've seen with both of these vaccines. So the headaches, the body aches, the arm pain, some of the swelling of the arm. The severity tends to differ from one individual to the other, but it's been pretty consistent what we've seen with the reaction that most people have. Now, when people usually talk about the flu vaccine and having a reaction, whether it's an anaphylactic reaction or the more severe reaction, something called Guillain-Barré syndrome, in which you can have temporary paralysis that may last a few days, it can last a few months. In terms of these two vaccines, we really haven't seen that. We anticipate we may, but we haven't seen it as much. And I don't have the data in front of me to take a look to see what the number of cases that we had in that from those studies, but we haven't seen it like we did. Now, if you had an anaphylactic reaction like Dr. Sequeira has said in the past against the flu vaccine, then that's the one we need to be very careful with because you may experience the same thing. An anaphylactic reaction is when your throat closes, you can't breathe, you know, they need to give you an EpiPen right there to really get you back. That's why we have you wait 15 to 30 minutes after you get the vaccine in order to be prepared, because if you will have that reaction will occur within minutes of getting the shot.
Okay, thank you. That is all the time we have for Q&A. Thank you so much, doctors and prominent leader, for joining us and allowing yourself to be asked those questions. And thank you for the very validated answers that you gave. If you were not able to get your question answered, I am going to drop my email address into the chat room. We will take a picture, a copy of the questions that you have asked thus far, and we will correspond to you with the answers. If you'll give us some time, we definitely will get those answers back to you. In the meantime, if you have new questions, please feel free to email me. I am a community health and education worker. I will do my best to connect with the doctors to get those answers to you. And I'd like to open the floor now for any final remarks that we have from our presenters. Or Pastor Casey, would you like to say something before we close, sir?
Not at all. Thank you so much for allowing me to participate in this most informative platform around the vaccine. Good to be on again with Dr. Michael Sequeira. Good to meet Dr. Javier Sanchez, and looking forward to building and growing with this august body of people. And to Dr. Jam, listen, new friendship and new relationship that I'm looking forward to growing. Your presentation was one of the best I've seen, and I honor you for that. And want to circle back and see if we can do this again. And
Yeah.
Nashay, it's always good to see you, sis. So proud of you and the work that you're doing. You're doing an amazing job.
Oh, thank you.
Yeah, for me, it's a pleasure to have the opportunity to be with all of you, and really, every time I do this, I really learn something new. There's a hashtag that's going around called "This is our shot," and I strongly believe that this is our shot, especially communities of color, to get back to normal, to vaccinate all of us, to get us back to with our families, get us back to our games, get us back to our normal lives. And we got to take full advantage of it. So I'm hoping and praying that you see this as your opportunity, as your shot to get back to normal. And the faster we can do it, the faster we can get back to our normal lives. And thank you so much for having me.
Thank you, Dr. Sanchez.
I wanted to thank Loma Linda and El Sol and all my fellow presenters and everyone here. And just to remind you and me that we are all in this together. We are being challenged. This is the greatest, largest pandemic in the last 100 years and more, and maybe in history. And we can't do this if we don't do this all together. So thank you for being here. Thank you for listening. Thank you for being vaccinated and wearing your mask.
Thank you, Dr. Sequeira.
Stay masked and stay protected. It's my pleasure to be able to contribute.
Thank you, Dr. Jam. Thank you, Dr. Matukupar. Thank you all for joining us today. I hope that you gathered valuable information that you can put towards your betterment plan that you already have outlined for your life in 2021. Thank you for receiving what we had to offer today. Please stay safe, wash your hands, and wear your mask. And good night.
Thank you.
Nishay, we have the survey.
Oh, where's the survey? I'm sorry. Don't leave yet. We have a survey. Oh,
it's in the chat.
Yes, the survey that I talked about earlier. You have 24 hours to complete that survey. The good news is that you will be entered into a drawing to receive a $25 gift card and that swag bag we talked about. So please fill out the survey, and we graciously do appreciate you. And now we can say good night.
Right.